What are you drinking there, Jessica Rubino?
Oh, I'm so happy you asked, actually. It's my afternoon sampler. I have my Suja green juice. I have my Kirkland brand organic bone broth, and then just a glass of water. And I've taken a few sips out of each one. What do you know? What's your afternoon beverage of choice?
Well, first of all, when you said sampler, I was thinking it was like, some, I don't know what I was expecting, but not that.
Like you were picturing like a flight? Were you picturing like a very like beautiful?
No, I just thought it was like you were gonna pull up like a 6-pack of different functional beverages, or I don't know what I was thinking. But
I'm sorry to disappoint you with my sample.
Yeah, I'm disappointed. You've disappointed me.
This is The Naturalist. In every episode, we're covering the products, ideas, and trends that are shaping the CPG industry.
Or that we just really like.
No, I am drinking water.
Beautiful.
Lovely.
Yes, and do you want to? So I'm going to tell you this quickly because I was thinking about this. I mentioned that I was sick last week. I was a little under the weather. And these glasses are from Asturias, so northern Spain. They're typical cider glasses.
Oh.
And I was thinking about this when I was sick last week, that in Spain, you'd go buy a bottle of cider. You're like 20 people in a group, and they give you 1 or 2 of these glasses. You're going to love this, Jess. And the typical thing is you pour the cider from up high. It gets all like fizzy in the bottom. They just pour like this much at the bottom. And then you kind of drink it like a shot. And you leave a teeny bit, and then you just dump that little teeny bit out over the edge where your lips touch the glass into the sawdust on the floor to sanitize. And then you pass it to the next person.
Oh, I do love that. I was wondering where that was going.
I know.
Sanitize. You had me at sanitize. Yeah.
But I don't know why I'm talking about this, but
yeah.
I'm glad you are. I actually have a lot of follow-up questions on that, but I'll save that for a different time.
What have you got, Erika? Hi, Erika.
Hey, thank you. I also just have water, but I finished my large mason jar of hydration. I do a hydration with mineral mix every day.
Oh, and everything's better in a mason jar,
Right? I know. And my little silicone straw. I'm a straw biter. It's one of my toxic traits. So.
Toxic traits. Well, that's great that you're balanced, that you're canceling it out by having it be a reusable straw. So it's perfect. Wait, what is in that mineral mix?
This is not an ad. This is not sponsored, but it is Liquid IV, the no sugar. Their new white peach flavor is my favorite. And then Trace Minerals, the liquid drops. Sometimes I put creatine in there. I actually also do the Ultima, the lemon Ultima. And that's stevia, I believe.
Okay. Yeah.
I like stevia. I'm one of those people. I like the taste of it.
Yeah.
So.
I don't like it. It doesn't bother me.
No comment.
So she doesn't like stevia.
You've heard my views on stevia on this podcast before.
Well, this was a good kind of way to kick things off because we have Erika Craft here. Erika, will you share a little bit about what you do? And you're going to talk about some of these functional and supplement trends that you saw at SupplySide. So
I am Erika Craft, market research analyst for NBJ, otherwise known as Nutrition Business Journal. And I do a lot of the research behind the market sizing and the trends behind, the supplement industry that NBJ is, one of the experts in tracking. And we just got back from SupplySide in Vegas last week, and that was great. It was really great seeing all the different trends. NBJ presented in about 3 or 4 sessions, I believe. So but it was also interesting to hear everyone's insights from other sessions as well. There was a lot of women's health talk. There was a lot of longevity, a lot of GLP-1 stuff, lots going on, a lot of excitement within the industry. So that's always great.
And I have a question. So you were there for 3 days?
3 days, Monday, Tuesday, Wednesday.
Did you go outside at all? That's always the big challenge in Las Vegas.
I didn't.
Did you
I
see
didn't.
outside a window at anyone?
Embarrassingly, no, I did not.
No, so it was just all ingredients. You were all in.
I
That's
was,
good.
and I say that's embarrassing, but actually I really didn't even think about it. And this might make me sound so lame, but it was like, I was having such good conversations. I didn't really think about it. And it was so engaging and there was just so much buzz. I went in at 7:30 and oh my gosh, it was 6:00.
No need.
I don't think that's lame.
Yeah.
Makes you sound kind of cool, actually.
Oh, thanks.
So, Erika, and for those who don't know, at SupplySide, unlike a Natural Products Expo in Newtopia, where the exhibitors are generally finished product companies, so you're seeing that functional beverage or dietary supplement or food product in its finished form, at SupplySide, the exhibitors are the ingredient companies. So it's really a great place to see that super early stage innovation. So if there's a new ingredient that's starting to be incorporated into a product, that's where you'll kind of get the latest on that early part of the supply chain. So when you're on the show floor, what types of things are you looking for to figure out, like, oh, is this ingredient going to be the next big thing in the nutrition industry?
I think what I've been seeing more of, and this is kind of a trend within the whole industry, it's not necessarily new, but I think from a supply side perspective, is this attachment to conditions or need states. You know, like typically there are a lot of booths or ingredient companies where they just say the ingredient, you know, flat out on all of their, you know, their booths and all of the, I guess the imaging, the content. But what I'm noticing more is I saw a lot of like women's health ingredients or just like women's health and then like a list of their ingredients and then like what they do. So they're almost like categorizing what they have. So it's easier to spot out. So, right, like if I'm a finished product brand and I'm trying to create a women's health product. And I might not be looking for one specific ingredient, but I know that this one, you know, company has them and they have different options. So I think that was interesting.
Yeah, that is really interesting because I typically go to SupplySide and I agree, like we've seen a lot of touting the ingredient itself, but if people don't necessarily have the context or the hook of what current consumer condition or need that's addressing, it may not be as appealing. So kind of organizing in, much like I think that kind of parallels what we see in retail stores now, where it's more of a focus on the benefit of the product, the benefit of the supplement than just necessarily the ingredient, with a few exceptions for those really well-known ingredients.
Yeah. And on that, like almost to your point of recognizing it and not necessarily knowing, at the show, they said that 44% of the attendees were first-time attendees. That's a lot of people.
Crazy,
and
yeah.
I was in a supplements 101 session and they're in the trend session and like more than half of the people that raised their hands were first time attendees. So there's a lot of like interest in this industry. People are getting into it. So it's more helpful now than I think it was in previous years.
So what are some of the things that you think people are looking for? I mean, whether they're formulators or brands that are there scoping out the scene or ingredients, manufacturers, you know, what are some of those big trends that are kind of top of mind right now or that people are maybe kind of looking into for the future? Do anything stand out?
Yeah, I know I already mentioned it, but women's health still just continues to be a force to be reckoned with, honestly. And I mean, there's so much within women's health, right? There's menopause, there's sexual health, hormonal health, and so because it's such a big category, and I think there still is a lot of room for innovation, science, education, formulation. I think that that's a big one and it's not going away anytime soon. You know, a lot of trends, right? It's like, oh, it's just this year, but like a lot of brands will say, well, what's for the next couple of years? I still see that continuing into the next few years for sure. And then longevity is still a big topic. Last year was really when it started to gain a lot of momentum and conversations. I still think that will be a trend into the future as well. Again, because there's a big net there. There's joint health, there's muscle health, there's brain health, you know, there's a lot of different components within it. And I think that there's a lot of opportunity, you know, depending on what target market you're looking for. And I know one of our writers, Robin, who is there with me, she also believes that biohacking within that longevity space is a big trend as well, specifically with, you know, millennials and Gen Zers really trying to optimize their health to a really, really high level.
And Erika, one quick thing on that you had mentioned earlier. So we had a really fun meeting earlier today where we talked all about trends and which trends we see having, the most impact in 25 and how 24 trends will evolve and all the things we love talking about. You said brain health specifically was the category that you're looking at within the healthy aging and health span conversation. Why is that, do you think?
Yeah. And it's actually brain health within longevity, I believe, as well as, when you're thinking about the whole supplement industry, we're actually, MBJ is predicting that brain health is going to be one of the top growing ingredients in 2024 and into 2025. So the reason that I think there's a lot of growth there and, talking with some people on the team as well, is that there's two different facets of it. There's the focus piece, the cognition piece, and then there's also, what typically I think brain health was historically built on was the memory, and it was typically older consumers, right? But now that we have a lot of younger millennials, even some Gen Zers where their older parents, grandparents are getting Alzheimer's and dementia, and they're seeing either friends or loved ones go through that process. I mean, I personally have gone through that with my grandmother, and it's something that my mom and I talk about all the time, of being preventative, finding certain supplements for her to take, different brain exercises to be doing. So I think it's really top of mind for a lot of people as this aging population ages and gets older.
So Erika, what were some of the other trends you saw?
Beauty from within is still a trend as well, both from supplements and personal care. I saw a couple topical products on the show floor that was targeting beauty from within, but also this, the longevity piece as well, more from like a wrinkles perspective. So I thought that was interesting. And the ingredients within it were interesting as well.
It definitely does seem like beauty from within, and then just like healthy aging topical products continue to increase in popularity. There's more launches, a lot of innovation there for a while. And this was like several years ago, maybe more, who knows? Long time ago, I was noticing companies that were launching topicals that you would pair with an ingestible product. And I never really saw that take off. And I think one of the reasons was because of some of the limitations at retail of being able to like merchandise those products together. And like retailers just figure out how to do it and consumers didn't understand. Did you see anything like that?
That's super interesting. I didn't, but also I will say I did not browse the whole show floor. So it's very possible that it was there. But I think that that larger conversation of personalization, like to me, that's what I think of when I hear you say that, is like this personalization where it's like not your typical, take a quiz online and I'll send you personalized supplements to you, but it's this different personalization where you're taking two different things and optimizing it for yourself. The most kind of personalization that I think the supplement industry as of right now can achieve.
Yeah, of how you pair and choose products and,
right.
and like kind of what you want the experience to be too. So yeah, I don't know. I would definitely, as of right now, file that under one of never turned into a trend, but I thought it was going to. So
when it does in a few years, we'll all come back to this and we'll be like, Jessica was right.
Well, another thing we've talked about a lot lately is HRT, hormone replacement therapy. I mean, that's very true of HRT. From my understanding, there's like topicals, there's suppositories. I mean, there's all different kinds of, there's pills, there's IUDs, so all different kinds of ways to approach that kind of therapy. So it feels like that's right on track with kind of what you were talking about, Jessica, and probably with what I would expect to see in the future.
Yeah, that's a great point. And actually, Adrian, leads to another trend that came up, and Erika would love to hear more about this, but just specifically in GLP-1s, but we're also seeing it with hormone replacement therapy, is the supplement industry really aligning with pharmaceutical drugs and saying, okay, there's an increasing number of people who are taking GLP-1s. We're going to provide the right support in the form of these types of supplements. Similarly to women who are on, estrogen therapies, or men taking testosterone, what are the other types of products and support that they need? So can you talk a little bit more about that? Maybe starting with GLP-1s, where there's still tons of supplement ingredients focused on offering a complementary approach there?
Yeah. And I think we could probably spend another hour talking about GLP-1s in the supplement industry and the hormonal sexual health piece, but I would love to talk about both. But I'll start with GLP-1s. So from an ingredient perspective, again, I didn't go throughout the whole show floor, so I'm sure that there were. But in terms of, kind of looking at it from two different perspectives of, looking at supplements that are either trying to do something similar to a GLP-1, right? I don't think that there are a lot of ingredients that can achieve the similar effect that a GLP-1 is providing consumers, in that, like, helping consumers lose more than 20 pounds, let's say. But I will say, I think that there might be some opportunity for certain extracts to provide maybe, 0 to 5, 0 to 10 pounds. I mean, we all know that there are people who want to lose 5 to 10 pounds on any given day. So there is a need for that. But in terms of the other piece of it, where it's this nutrition profile that supplement companies can provide products for those who are either currently on a GLP-1 or have gotten off a GLP-1 where they really need that support, whether it's protein, fiber, prebiotics, probiotics. I think that there are a lot of products coming out, whether or not they're specifically formulating specific ingredients to do that, or if they're putting it on the label. I think that there are both within that, right? I think people are kind of just putting it on their label and hoping that it grabs some attention. But I also think that there are brands out there doing what they need to from a clinical perspective to provide that nutrition for consumers. So I think that it's a huge market opportunity for the supplement industry. I mean, it's all anyone's talking about. Last week in conversations, I know I mentioned it this morning, if your conversation didn't start talking about GLP-1s, it certainly ended talking about it. And just the opportunity that it provides for brands is pretty significant.
Erika, do you think in 3 years, will this still be a huge opportunity, or will it be totally saturated? How long is this opportunity going to last, do you think? And then what better question for you of all people who are tracking what's now and what's next and using data to inform that. So talk about coming back to a recording in a few years, this moment.
I do. I think even longer than 3 years, it's still going to be, making disruptions within the market in a good way, right? Like, you can read disruptions as like, oh, it's going to be bad. I mean, for a minute there, people thought that it was going to, lower meal replacement sales because people are eating less. But actually, we're seeing that people are taking meal replacement supplements to help them with that. And this growing base of consumers, of those who are now off of Ozempic or a GLP-1 like drug, right, is only going to grow. There's only going to be more and more people going on this within the next couple years. So I kind of compare it to the pandemic. It's obviously very different, but you're having a huge market of new consumers entering, and it's about finding out where they're at in their journey and holding on to them throughout their supplement journey as well.
Something just came to me as you were talking of like predicting things. Adrian and I like to play games on the show sometimes. So like out of the game, that could be like, our sales of this ingredient. And if you need to check, let's not be a prediction. Sales of this ingredient, are they going up or are they going down?
Should I throw her a softball to get started? Creatine.
Oh, sup.
Collagen.
Sup.
Probiotics.
Sup.
Berberine.
Ooh. I say sup.
Ashwagandha.
That's a good one. Honestly, down. I say down. I don't see a whole lot left in that market. That's not to say it's a dying ingredient and no one's ever going to take it, but I don't see it gaining any more popularity or traction.
CoQ10.
Ooh, sup for fertility purposes, I would say.
Well, we're intrigued.
Yeah. I know we didn't talk a lot about the sexual health piece, but there's a lot of ingredients within that. And then also at the show, there was a lot of both men's and women's ingredients for sexual health, fertility, reproductive, hormonal health. I think there's going to be a lot of runway with that category as well. I
literally just got the sup thing.
I thought you were going to go crazy for it.
I was thinking, like, what's up? How about here's another softball, CBD.
Unfortunately, down. I did, however, I was talking to someone who created a CBN, which is, I'm not a science person, but it's some other form of derivative. And from a chemical basis, it's a little bit different in the structure, but it's supposed to help with sleep. And they are doing clinical trials and doing stuff with the FDA. And so I don't know. I don't know if that's enough to make it a sup, but it was something.
No, that is interesting, Erika, because that felt like a big opportunity that people were talking about. There were like a few others, I think, is CBG also. Like there's like a couple.
Any letter.
Yeah.
Yeah, it just throws.
Just pick a letter.
They're on to N now. That was G. Now they're on N.
What about functional mushrooms?
I didn't see a whole lot. I think there's really right now is collagen, probiotics, prebiotics, fiber right now, protein, and a lot of branded ingredients as well. But no, I didn't see a whole lot of functional mushrooms. That's an interesting one.
And any ingredients, like any super emerging ingredients that maybe people haven't heard of or are as familiar with that you were seeing a lot of for unique uses. I remember you saying algae for beauty, which I think is a one. And I think algae is a collagen stimulator or something in algae is a collagen stimulator. Is that right?
Yeah, I think so. I don't know the science behind the algae or the seaweed, but at MBJ, we track that as like a plant-based omega-3. And there's been a lot of talk in that category the last year and a half, I would say, just because it's more sustainable, right? And, fish oils, there's such a wide variety of benefits. So I think that could be some traction within that category. But yeah, the seaweed within the beauty from within was an interesting one from a topical perspective. I don't know the difference of topical versus ingesting. Maybe it has more benefits using it topically. I'm not sure.
We'll have to sit you down with some seaweed beauty products and those kelp pickles from Utopia Now.
Oh, I love pickles. I'm happy to do anything, really.
Well, Erika, this was so fantastic. Thank you so much for bringing your supply side experience here and filling us in on all the latest trends and things that you saw on the show floor. Any final thoughts?
No, I mean, it's just there's so much to be excited about within the supplement industry. And it's like, last year I was there at SupplySide and it was, healthy aging and, probiotics and a little bit of collagen. But, now this year, just with all the disruption with GLP-1s and there's a lot of similarities, but there's also a lot of new trends going on. And so it's, you think you have a good handle on things and then something totally different happens. So I'm really excited to see where we're at in even 6 months from now to see if it's similar, if it's different. I know SupplySide always does a great job of keeping on track, and so do we. And so it'll be interesting to see where it goes.
Well, thank you very much, Erika. We'll have you back in 6 months sooner, Evie.
Mark my calendar.